At least 5 million people in the United States are currently living with dementia. The Director of Behavioral Medicine at Pomona Valley Hospital Medical Center, Dr. Daniel Blocker, discusses dementia and how family members can help.
Dementia is the loss of memory, the loss of identity, the gradual decline of your ability to have memory.
Family members and other resources are essential to keep the patient safe.
Family members, first of all, are incredibly important in the care of those who have dementia. The way they react and respond is so important. Oftentimes there's denial or there's ignoring, in part because nobody wants to think that their loved one has dementia. For adults who are incredibly intelligent, they can usually mask the symptoms of dementia. They can make offhand comments about, oh, of course, or after they repeat themselves, I know I repeated myself. Over time, that gets worse. And I think that's one of the hardest parts of dementia, is that it's a chronic worsening problem. Over time, more and more gets lost. So for a family member, there can be an ongoing sense of grieving, especially if the caregiver is a partner versus a child. Caregiving is probably one of the most sacred things a person can do. Family members can do several things to make the home a safe place for a family member with dementia. Among those things is reducing access to things like the stove, or to knives, or other things that with dementia they may accidentally leave on, or they may harm themselves with. You want to make sure your environment is as safe as possible. You also want to make sure it's as happy that it's like home, that it's a place where there's love, where there's a place where there's security. It is a work of love, but it requires a lot. So finding ways to take shifts, to work as much as possible with other people. Thankfully, there are many programs that offer caregiver relief, where you can bring your loved one to a place where they'll be watched for a day, and you can go do the things you need to do. Those programs are available in many different places. AARP and other resources like that provide many presentations, many support groups for parents or for loved ones providing care for someone with dementia.